Welcome to Fertility Doc Talk. I'm your host, Dr. Kaajal Abrol. I'm a board-certified obstetrician-gynecologist and fertility physician based in Toronto, Canada. My goal is to educate patients, partners, and the public on fertility and to destigmatize infertility. Through this podcast, I aim to increase knowledge and awareness about reproductive health to empower people to make informed decisions about their own fertility. Welcome everyone. Today we are going to talk all about the menstrual cycle. Understanding the menstrual cycle, what is normal and not so normal, is key. It is the foundation to understanding your fertility. Throughout this podcast, you will notice that I like to break things down into phases, stages, or steps. This helps keep things simple, digestible, and clear. So we can break the menstrual cycle down into 4 main phases. Phase 1 is the menstrual phase. This is where you have your period, also known as menses. This means you shed the lining of your uterus, also known as the endometrium. The lining of your uterus sheds due to a drop in progesterone levels in your blood, which happens if a sperm does not fertilize an egg in the second half of the menstrual cycle, which we're going to talk about in a few moments. Phase 2 is the follicular phase. Every menstrual cycle, a group of immature eggs come from deep within the ovary to the surface of the ovary. These eggs each sit in a sac of fluid called a follicle. In this follicular phase, one of the immature eggs matures within its follicle, and as a result, the follicle grows in size. The immature egg grows and matures in response to a hormone that's coming from the pituitary gland in the brain and acting on the ovary, called FSH, or follicle stimulating hormone. And as the egg matures in the ovary, it produces estrogen, which then acts on the uterus to stimulate the endometrium, the lining of the uterus, to thicken. We can follow growth of the follicle and thickening of the lining of the uterus on ultrasound, and we can monitor the estrogen produced by the maturing egg in the blood. Phase 3 is the ovulation phase. This is where the mature egg is released from the ovary and picked up by the fallopian tube. Ovulation is triggered by another hormone from the pituitary gland in the brain called LH, or luteinizing hormone. The increasing estrogen from a maturing egg triggers a surge of LH from the pituitary gland, leading to ovulation. The LH surge happens about 24 to 36 hours before ovulation. Phase 4 is the luteal phase. This phase is essentially the second half of the menstrual cycle. The egg, which ovulated from the ovary and was picked up by the fallopian tube, will stay in that tube for approximately 24 hours. Either the egg will be fertilized or it will not be fertilized and it will break down and disintegrate. After ovulation, the follicle that released the mature egg is now called the corpus luteum, and it produces progesterone to help change the consistency of the endometrium, to get it ready for implantation of a pregnancy. One helpful way to understand estrogen and progesterone and their role on the uterine lining is to think about estrogen as the fertilizer. It helps build and thicken the lining of the uterus, and progesterone as the lawnmower. It changes the consistency of the uterine lining to prepare it for pregnancy. If the mature egg is fertilized by sperm, estrogen and progesterone levels will stay high, both produced by the corpus luteum. If the mature egg is not fertilized, the egg disintegrates, the corpus luteum disintegrates, and the estrogen and progesterone levels drop. And it is this drop in progesterone that triggers menses, or your period. If fertilization occurs, implantation will occur approximately 5 to 7 days later.
and then the placenta will form and produce HCG, or human chorionic gonadotropin.
It is this HCG that stimulates the corpus luteum to continue producing progesterone until the placenta is fully functioning and producing enough progesterone to support the pregnancy, usually around 8 to 9 weeks gestation. One thing to note, if the follicle that grows and develops in the follicular phase does not rupture at the time of ovulation, you can get what is called a follicular cyst. This is a physiologic cyst, meaning a cyst that forms as part of the menstrual cycle. There's nothing to worry about with these cysts. They usually resolve on their own, generally taking a few weeks. A few key points to remember about these 4 phases and their hormones. In the follicular phase, the first half of the menstrual cycle, FSH is the important hormone, and it is an estrogen-dependent phase. In the luteal phase, the second half of the menstrual cycle, LH is the important hormone, and it is a progesterone-dependent phase. So in reviewing these phases, I hope it's clear that a menstrual cycle does not just refer to your period or menses. It includes all 4 phases of the cycle, from the first day of your period, through development of a mature follicle and egg, to ovulation of that egg, and preparation of the uterine lining for potential implantation of an embryo. Now that we have spoken about the basics of the menstrual cycle and what is considered normal, let's briefly touch on abnormalities of the menstrual cycle and some of their common causes. Some of these are going to be discussed in upcoming episodes, but let's break down the various abnormalities associated with menses. Amenorrhea. This is the absence of periods. They are not coming at all. Some possible causes include significantly low or high body weight, excessive exercise, excessive stress, and genetic causes. Menorrhagia. This refers to heavy periods. Some possible causes may be structural, like fibroids and polyps, hormonal, like thyroid disease or polycystic ovarian syndrome, bleeding disorders or other illnesses like kidney or liver disease. Dysmenorrhea. This refers to painful periods. Possible causes of dysmenorrhea include endometriosis, fibroids, and adenomyosis. Now I thought that we would dive into some common questions that I hear about the menstrual cycle, because I think it helps to understand the 4 different phases even better. The first 2 questions go together. Are my estrogen and progesterone levels okay? And are my hormones balanced? As you can gather from the detailed description of the menstrual cycle that we just went through, it isn't as simple as a yes or a no, because estrogen and progesterone levels change throughout the cycle, and that's normal. So you can only interpret these levels if you know what day of the cycle they were tested on. For example, if I see a low estrogen and a low progesterone, I'm suspecting the individual to be very late in the luteal phase, towards the end of their cycle, or very early in the next cycle, in the early follicular phase. Alternatively, if the estrogen and progesterone levels are both high, I'm suspecting someone is in the mid-luteal phase, just after ovulation. But knowing what day of the cycle it was when the blood work was done will help interpret whether the levels are within the normal range for that time of the cycle. Another common question I hear relates to the length of the menstrual cycle, specifically what is considered normal for length of a menstrual cycle. A typical cycle is approximately 28 days, but there is some normal variation to this. So we generally say a cycle can be anywhere from 21 to 35 days in length. The luteal phase should be fairly consistent, close to 14 days in length, and it's the follicular phase that may be more variable, sometimes as short as 8 days, but can be much longer as well. So for example, if your cycles are 26 days in length, the follicular phase should be about 11 days, the luteal phase should be about 14 days, the menstrual phase overlaps with the first part of the follicular phase, and ovulation is about 1 day between the follicular and the luteal phases. If your menstrual cycle length is not regular or predictable, with more than 5 days of variability cycle to cycle, you may not be ovulating regularly or predictably, because it is the development of a mature follicle and egg, and then ovulation, which leads to the drop in progesterone levels, which then triggers menses. Not surprising, another common question I hear is, should I worry if my period is late by 1 day? There is generally nothing to worry about if your period is late by a day or even a few days. It is possible that you ovulated a day or two later than usual for you, and thus you get a period a bit later. Taking a pregnancy test can help confirm if pregnancy is the cause for delay, but otherwise I would wait a few days and see what happens. Another common reason for delay can be stress, which affects ovulation.
Related to this topic of cycle length is the question, do I need to have a period every month? This really depends on whether you are trying to conceive or not. If you are, then having a regular monthly cycle is important, as it reflects regular predictable ovulation. And we want this because without ovulation, there is no egg to meet sperm to give a pregnancy. If you are not trying to conceive, then you don't need a regular monthly period because you don't need regular predictable ovulation. We do, however, want you to have a period at least every 3 to 4 months. This ensures that the uterine lining, which has thickened by estrogen, is shed, because if you have too much unopposed estrogen for long periods of time, you are at risk of developing precancerous and cancerous cells of the uterine lining. I often tell my patients with irregular cycles that if they are not trying to conceive and seeking fertility treatment, and their periods space more than 3 to 4 months apart, they should see their primary care provider for either the birth control pill, which they can take daily, or progesterone, which can be taken for a short period of time every month to shed the lining of the uterus.
Questions around progesterone levels in the luteal phase are also quite common and a big concern. Specifically, do I have a luteal phase progesterone deficiency? This is a tricky question. It's not that easy to diagnose a progesterone deficiency. Some possible signs of a luteal phase deficiency include a short luteal phase, like 8 to 12 days, not the typical 12 to 14 days, or spotting in the mid-luteal phase. But it's hard to do a blood test to easily diagnose this. This is because progesterone from the corpus luteum is released in pulses in response to the LH pulsing from the pituitary gland. So a level that is above normal levels for your lab may confirm ovulation, but doesn't necessarily tell us if there is sufficient progesterone there to support the endometrium for the entire luteal phase. So we often base things on history. Do you have spotting? Do you have a short luteal phase? And we will give progesterone supplementation if there is any suspicion of a progesterone deficiency. Another question that may come to mind, and one that I am sometimes asked about, is do I need to worry about bleeding in between cycles? As I just mentioned, mid-luteal spotting may be a sign of luteal phase progesterone deficiency, but this is not the only cause of mid-cycle spotting. Bleeding in between cycles, also called intermenstrual bleeding, may be due to other causes, which can be investigated by your doctor if the intermenstrual bleeding persists for more than a few cycles. For example, it may be a structural issue, like a polyp or a fibroid in the uterus. An ultrasound and a sonohystogram can help rule this out as a cause. It may be hormonal, involving your thyroid or your prolactin, for example. Blood work can be done to rule out hormonal causes. It may also be due to an infection. For example, sexually transmitted infections such as gonorrhea or chlamydia are infections that affect the cervix and may present with abnormal spotting or bleeding. It may also be due to abnormal cells of the cervix, so precancerous or cancerous cells. This is why your doctor will often ask when your last pap smear was and swabs for infection. It's important to make sure these are done regularly. What about clotting? I'm often asked, is it normal to clot during my period? In general, you do not need to worry about clotting during your period. During your menstrual cycle, the body releases anticoagulants or blood thinning factors to help prevent the blood from clotting. This is why you usually get steady blood flow during your period. However, if your bleeding is heavy, there isn't always enough time for these factors to take effect, and thus you may see some clots. I have left one of the most important questions I hear until the end, and this is, when is day 1 of my cycle? Day 1 is the first day of full blood flow. Some people may have a few days of spotting leading up to the first day of full flow, and we do not count this as day 1. Some spotting just before full flow may be normal, part of your menstrual cycle. Sometimes it may indicate something else is going on, like a hormonal or structural issue. Not always an issue, but something your doctor can look into. When you are trying to conceive naturally or simply trying to track your cycles, try your best to determine the first day of full flow, not to worry if you're off by a day. When you are seeing a fertility doctor and undergoing fertility treatment, you can worry even less, because when you report your day 1 in order to start fertility treatment, you will usually be asked to come in for blood work and ultrasound on day 3 or 4 of your cycle before starting any treatment. And we will be able to determine if this was in fact your true day 1 from your ultrasound and your hormone levels on day 3-4. So there you have it, the basics of the menstrual cycle. The 4 phases that make up your menstrual cycle: menses, the follicular phase, ovulation, and the luteal phase. The importance of the 4 main hormones: FSH, estrogen, LH, and progesterone. And the significance of a regular menstrual cycle and ovulation, especially when trying to conceive. I hope that this episode was useful in allowing you to better understand your menstrual cycle, what is considered normal, and what certain abnormalities may be caused by. That's it for this episode of Fertility Doc Talk. I really hope you enjoyed listening and learning and feel empowered about your reproductive health. If you enjoyed this episode, please remember to subscribe to the podcast and tune in to our next episode.